Okay, hi everyone. Thanks for coming. It's my, I think most of you know me. If you don't, I'm Jim Lavery. I'm here in the department and I'm chair of the search committee. Thank you for all the search committee members for all of your hard work and for being here. It's my great pleasure to welcome Ethan today. Ethan Coston joins us from Atlanta today, which is handy, but also from Virginia Commonwealth University, where he's an associate professor of gender, sexuality, and women's studies, and also PI on a very prestigious Pioneering Ideas grant with the Robert Wood Johnson Foundation. So Ethan, real pleasure to have you with us and really looking forward to your presentation.
Thanks so much. Hi everyone.
Hello.
How are we doing today? It's a little cold. It's Friday. It's alright, so we're fine. We're surviving. We're good. Well, thanks, Jim, for that introduction. So, yeah, I'm Ethan. You can use they or he pronouns or both. For me, I like when you can mix them up with wild abandon. If that's something that's within your skill set, please feel free to do so. By way of visual description, I'm a 5'10", sort of masculine-looking individual. I've got short brown hair. Today, I'm wearing really small silver geometric glasses, a black mask, a black knit polo that's sort of long sleeve and button up. And when I'm talking, for those of you who are here and can see me, you'll notice that I have a very heavily tattooed body, including 2 full arm sleeves. So if you'll allow me an immediate tangent, make sure this is working. An immediate tangent to introduce myself to you. I wanted to actually share this picture. It might be hard to read, so I'm going to tell you what it says. From my 3rd grade journal in class. I found it in a box of things that my mom recently gave me. And you might be able to see here at the top that I said in 3rd grade, what I plan to be is a doctor with an E, don't. A doctor working on all things. Very ambitious, very ambitious. And down here I said, the great honor I would most like to receive is the Doctor's Award of Awareness. So this is 8-year-old me. Now, I didn't grow up in a highly educated family or a highly educated town. My dad is actually the only person in my family who has a bachelor's degree, other than my mom got one after I got my PhD, so now she has one too. But at this time, he was the only one, and he took 12 years and failing out of 3 colleges before he did it. So I'm guessing that 8-year-old me was thinking Doogie Howser. Anyone?
Yeah.
So Doogie Howser, MD. So I didn't end up being an MD, but I am proud to say, and you can see some of these things, I won't list them off, that it took me a while to figure out where my place was within this sort of science, medicine, health ecosystem. But I found my way, and I sort of wear a variety of hats and take on a variety of roles today that make me feel like I'm on the right track to promoting some level of what I think 8-year-old me was probably thinking more along the lines of is equity, justice in the work that I do. And like many of you, I've been thinking a lot about the future of public health lately. As I watch the 47th presidency cast reveals, and think about how the platform is one that is very seriously fomented on anti-science propaganda, disinformation, and literal racism, misogyny, and transphobia. And we encountered a lot of problems the first time around. So this is actually the Silencing Science Tracker, which is an initiative that recorded all of the attempts by the federal, state, and local governments to essentially restrict or prohibit scientific research, education, or discussion about scientific research, and the publication or use of scientific information. And according to this tracker, between Trump's first election and President Biden's inauguration, there were 346 anti-science sort of bills or laws attempted to come into being at the federal level, and 156 at the state or local level. But as many of us know, this sort of anti-science rhetoric didn't end when Biden took office, from mask ban laws to the ever-shifting COVID isolation policies that were very clearly influenced by corporate interests, to the fall of Roe with the Dobbs decision, and state level bills that are really, most people know, predicated on absolute junk science, to the attacks on trans youth's access to gender affirming care because of made up stories about receiving surgeries in their local middle and high schools. It's really not hard to see how we have some days ahead of us. And so I could take that conversation in a lot of directions because it keeps me up at night. But I want to actually link it back to my work and my lived experience. And that's in the field of trauma and mental health. This is all very traumatizing. We are in a time of immense, unprocessed grief and increasing psychological and emotional distress. And that's all of us, right? The world is an increasingly violent place. Our governments are acting increasingly violently. And I'm about to put some pictures on the screen that are not graphic, but may, bring up emotions or be triggering for some folks to see regardless. We witness in real time, alongside this anti-science propaganda and public health orders, with 24/7 access on tiny visual computers in our hands, things like war, genocide, ecocide, global exploitation, climate crisis events over and over and over. We see Nazis running openly through the street with their flags in Columbus, and people with AK-47s showing up outside of children's stories hour at libraries. Foodborne illnesses, even before someone knew that we might not want to be in charge of it, takes over the FDA, are at way higher levels than they need to be. And we've seen resurgences and surges of diseases, some of which we thought we had all but handled, like measles, mpox, TB. People are sicker than ever before, and of course a lot of that is likely due to COVID. Over 7 million people have died, 1.2 million of which are from the US. And new emerging research shows that COVID-related deaths are probably undercounted by a magnitude of 1 to 2 times because, again, we're in a time of science denialism, and people are not counting vascular-related events that might not have happened otherwise as being COVID's responsibility. Even when you undercount those deaths, COVID remains the 4th leading cause of death in the US and is a mass disabling event even among children under the age of 10. Pregnant people, particularly pregnant Indigenous and Black people, are dying at higher rates right now than they were in 1969, which is prior to the enaction of Roe. And it was actually the preventable deaths of Amber Nicole Thurman and Kenny Miller here in Georgia that led a judge to side with Sister Song, a local advocacy reproductive justice organization, in temporarily allowing abortion access to resume. We have elected a known sexual abuser to be the next president, and his cabinet is being filled with people who are either known for or currently under investigation for child abuse and sex trafficking, and other attempts at harassment and misogyny run on a pro-natalist agenda that may, in the coming days, very well attempt to strip women of their rights to vote and their ability to divorce their husbands. In the 2 weeks since the election, young boys have been found at local high schools and middle schools all across the US shouting, "Your body, my choice," at young girls, a phrase that they got off of the manosphere from popular influencers. Violence and death are all around us, all of the time. And these are only a few of the relevant ways in which we are being individually and collectively traumatized on a daily basis. And even though the bread and butter of my academic and scholarly life for the better part of the last 15 years has been mental health and trauma and well-being, I am unwell. I am unwell because for the past 2 weeks, being a late-in-life trans person who transitioned, have actually had to work to get all of my paperwork in order, out of fear that it might be possible that the government doesn't allow me to try to travel outside of the country, tries to strip me of my rights to access to my health care or medication, or worse. I am unwell because my family of choice is being absolutely terrorized by racialized violence in their own so-called progressive communities. I am unwell because my students are receiving text messages about picking cotton on plantations, while they simultaneously are also terrorized by militarized police forces because they don't want actual military forces to terrorize people in other places. I am unwell, not in the "I'm going to end my life" way, but in the how could any of us be anything other than unwell right now? And here I'm actually taking inspiration from the work of feminist scholar Mimi Cook and trans-somatic practitioner Kai-Cheng Tam on the politics of unwellness and radically reorienting our relationship to what mental health and well-being really are. Very simply, I wonder what would happen if we all approached life and work from the understanding that we share collective suffering. And here we really need to talk about the elephant in the room. This suffering that we share collectively, it is socio-political and structural in nature. And as public health practitioners and researchers, we may very well say that we care about and attend to the so-called social determinants of health. We can name those things, we can quantify them, we can survey them, we can track them over time, we can make them measurable. But do we really, and I mean deeply, feel in an embodied way the social determinants of health in our everyday life? Are we willing to admit the ways in which we, like the many people that we often engage in researching, are also traumatized by the world around us? Will we shift how we engage in our research based on this understanding and knowledge that sometimes the best remedy for a problem is not individual behavior change? The answers to these questions are not easy ones, but again, what keeps me up at night is thinking about how we do this work. And lest I spend too much time up here on my trauma pulpit, which has been known to happen, and I go wildly off topic, I want to make a transition into talking more about the how of it all. And so for my purposes here today, that's thinking through critical implementation, science approaches, sort of equity-focused approaches, sometimes called community-based participatory research, sometimes called feminist participatory action research, sometimes called citizen, which I don't really love, so I call it public science instead of citizen science. There's lots of names that we might throw around for the general umbrella of how we could do some of this work while we search for not only solutions, potential solutions to our collective suffering, but also think, is there a world in which flourishing is possible? So I'm going to start with the basics, but I'm going to be brief because I'm sure a lot of you already know these basics. But what is translational science or dissemination and implementation science? Well, in a traditional or historical framework, it's really research that attempts to determine if an intervention, a program, a drug, etc., could work, whether or not it does work within a particular context or container, how to make it work within that context as best as it possibly can, and then once you figured all those pieces out, how to get it to be taken up by the community or the people who would benefit from it most. But over time, quite a number of researchers, often led by community members and community voices, have showed their concern over the lack of ethics, accountability, and shared decision-making power within these processes, or how they're often engaged in by research teams. And so other models have emerged. They've been theoretically constructed, they've been tested, they've been suggested for wider uptake. This is one example, the integrative framework of dissemination, implementation, and translation. Its creation was really trying to think about how we accelerate research translation to benefit public health, not just to sort of be a good publication. And at the center, you'll see stakeholders, right? Everything we do revolves around these stakeholders. How is the knowledge we find used by stakeholders? What's the impact of what we do on the stakeholders? What do the stakeholders really want? But again, in models like this, I often start to question whether or not stakeholders really means people, community, right? So I always go back to my home base, and I won't spend much time telling you specifically about what that home base is, but I go back to this critical feminist meta-science and what some people call the hermeneutics of suspicion. So that's a very philosophical thing, the hermeneutics of suspicion. I could give a whole lecture just on that, but essentially, I am critical of the health science knowledge ecosystem as a structure. I spent a lot of time studying about epistemic cultures, or this idea that every scientific practice is culturally, socially, and politically situated, right? nothing we do is outside of our own biases, our own culture, our own norms, and particularly the norms for our disciplines or our fields and what we've been taught is right or wrong to do in research. I know that truth is a fickle, complicated thing, and I don't operate from a positivist center. Academic knowledge is important, sure. We have our methods, we have our rigor, we have our process. But academic knowledge, in my opinion, is no more rigorous than the knowledge of lived experience. And I don't think that it should be automatically privileged as better than the knowledge of lived experience. So knowing this, I want to share two frameworks for the projects I'm currently working on that we've sort of been inspired by, guided by, led by. The first one, which you can see here, is the Promoting Action on Research, Implementation, and Health Services framework, or the PARIS framework. And then next I'll tell you about the EPIS framework, the Exploration, Planning, Implementation, and Sustainment framework. So here you can see in the PARIS framework, there's a lot of interconnected pieces, but what we were particularly drawn in by was the knowledge, the way they think about evidence up here. And evidence includes both codified and non-codified forms of knowledge. So yes, evidence-based out of the research enterprise is very important. Practitioner knowledge and experience is very important, but so are community preferences and experiences, community knowledge, and local contexts, right? And then we were also very interested in thinking more about this context bubble here, in which if you read in the full framework and how to implement it, they talk about how really effective implementation is actually a complex process that involves negotiation with community, so that you know not only whether or not a community wants a particular intervention that is said to be the best evidence-based practice, but what the actual disadvantages, risks, and losses of a new practice over the old ways might be. And then there's the EPIS framework, and so this framework has been really what we, so I'm going to tell you in a moment about the sexual health exploration project that I lead, and we spent the whole first year sort of building this model out for ourselves, but what we like about it is the ability to be fluid, adaptable, and to change our practices based on both internal and external factors or forces. So in this framework, community at the center considers what are the emergent and existing health needs in this community. They identify, along as co-investigators, the best evidence-based practices to address those needs, and then we decide together whether or not to adopt them or to overhaul and adapt them. Preparation to do any amount of implementation involves reflexive, iterative, ongoing feedback, training, and deep community engagement. And here I mean with community as co-investigators. And so, of course, you have your inner context, which can sometimes make you more or less successful, and your outer context as well. But you consider those factors alongside community knowledge. So deeply historical, very relevant knowledge that only community often can bring to our projects. And so taken together, my approach to this work is that this is health justice in action. It's the only way I can think of to effectively address the root causes, that is the structural and socio-political causes of our shared suffering. Because here's what I do know in doing this work. We are never going to solve our ongoing health crises if in the process of trying to do that, we commit epistemicide. So let me tell you a little bit about what that looks like to sort of center alternative ways of knowing and being in a health equity project. So to give you a little bit more background, again, I'm a social and behavioral scientist, really focused primarily in the early days on intimate partner violence, mental health, and trauma, particularly as it related to LGBTQ plus folks, but primarily plurisexual, so that is sometimes called bisexual, queer, pansexual, so non-monosexual folks, and transgender people who, the research has shown us are disproportionately impacted both by rates of intimate partner violence and the negative mental health outcomes from those experiences. And most of my work prior to COVID was actually secondary data analysis on existing data sets, health services data. Some of that work was funded initially by a Robert Wood Johnson Foundation fellowship, but I was just trying to build an initial evidence base. And then once that evidence base was more firmly established, I started partnering with community members, students, local organizations, statewide and national organizations on addressing community needs and advancing protections for survivors in our community. As just a few examples, we, along myself with the Virginia Anti-Violence Project, we coordinated community wellness sessions. You can see advertisements for one of them here, in which we actually we spoke with community about the resources that they needed and also then brought in the services that they had asked for related to their wellness. So that meant trauma-informed massage and nail spa services for Black trans women in our community, a paint night, like a guided, paint night at a local art studio for young men and boys, and then pictured here, gender-neutral bachata dance lessons for a Southside community of primarily queer and trans, Latine, and Afro-Caribbean folks. I also have worked with students in, so I'm in a humanities department with very little resources and funding, so students are also primary community to me, and we do this work together collectively. So I've worked with a number of undergraduate and graduate students on some other programming. Again, COVID has made some of these things more and less successful over time prior to my grant funding. But one was, the students had titled it affectionately the Queer and Teen Archive Project, in which we engaged the queer and trans community in sharing stories of joy, beauty, pleasure, flourishing, and resilience and thriving during the early days of the pandemic, a time when things were obviously very dark for a lot of folks. There were also some really beautiful stories that emerged for queer and trans folks during that time, which was near and dear to my heart because it was actually being in the isolation, the early isolation days, that made me decide that I did want to transition. So I know that some beautiful things came from some of those dark moments as well. There was another program that we ran, a year-long program that we ran, where students actually went to a local detention facility and ran these listening and storytelling and art sessions with incarcerated women, in which they reflected on what their lives in the world would be like if there were no prisons. So we held these sessions across an entire semester. This is artwork that these women sort of put together. And then the students worked to project the artwork and the poetry on our big screen outside of the library so that all of the campus could sort of see this work. And then on May Day, May 1st, they held a teach-in on campus, so a free course on what they learned. And they took videos of it and pictures of it. And then they went back to the facilities and they shared the sort of reach and the outcome of these women's words and artwork on the folks who were around. They also organized and received 500 books to donate to the facility's library on topic areas that the women were interested in, and we linked 25 women with pen pals, student pen pals, for constant communication, about 80% of which are still active to this day. And then in the summer of 2019, I started a research project that I thought was going to be it. So the summer 2019, so we're thinking about time. I thought this was going to be it. And it was a summer wellness series with LGBTQ plus youth, partnered with VCU's Office of Sustainability in our free community garden. And what we essentially did was we worked with a youth organization called Side by Side and held sessions in which we asked youth, what do you want? What do you need more of to feel good in life? And so they came up with these areas here. So they wanted to learn how to take care of their own plants at home. They wanted to do some, we brought in actually a local indigenous person who was known for drum circling. They wanted to do somatic, sort of like embodied things with dance. They wanted to learn more about mindfulness and yoga and meditation. They wanted to practice creative writing. We took them foraging, urban foraging, so we just went around the plot next to like the highways and the dumpsters, and we had someone who was an expert say, okay, this is edible, but this is not, and so they learned how to source food from the cracks in the concrete. And then we also, at the end, all got together and we planted, from the garden, we planted things at Side by Side because the outside of the building is basically just concrete. And so we wanted to give it some vibrancy and appeal for the youth who were coming in. And we also, during this time, when we brought them together, they learned how to farm in the urban garden. So they harvested and they learned about planting seeds and growing things. And then we shared a big family meal at the end of the night. And we did measure for this particular program. We used Tori Key's Flourishing scale, the mental health continuum scale. And we measured at the beginning and at the end, and then at the end of every session. And their psychosocial flourishing scores really increased significantly, even over just the one summer that we were together. And we were all set to do it a second time, and then COVID. And so after I came out of the fog of those first 6 months or so, 8 months or so of the pandemic, where my work was really just sustaining ongoing collaborations with folks in other departments, and I was going up for tenure, I decided I'm going to write a grant. So getting a grant in my department was not something that was going to be necessary for tenure, and I just thought, well, I do health equity, mental health work, so it can't look bad to have like a $500,000 grant under review when I go for tenure. They'll be like, oh yes, that's just one more check to get you over that hurdle. But before this, so I have a 3-3 teaching load in my current institution, and I was in a 5-5 load before that, and then I was a professional adjunct for a few years. So, I was just writing a grant for me. If I could do any project that I wanted to do, what would I do? Let's write that grant, because they're not going to pay me that much anyway. And they did. So, so now I'm stuck doing an overly ambitious project. No. So essentially, I wrote to the Robert Wood Johnson Foundation. They don't call it Pioneering Ideas anymore, actually. They just call it the Ideas Project. But I wrote to them and I said, you know what, I have an idea. I think in order to effectively intervene on most of the negative sexual health outcomes we know exist, so high rates of STIs, maybe even things like unwanted pregnancies, but also things that increasingly youth are engaging in risky ways, like rough sex, so choking without knowing how to do that thing, hitting each other is becoming very, very common among youth these days, and intimate partner and sexual violence. In order to do anything about those problems, we actually need to know a lot more about people's sexualities than we currently do. Because we operate from a deficit approach, and also most of the nationally representative data asks only one question about sexual orientation or identity. Often it's a very bad question. We don't know anything about people's desires or their fantasies, why they do things. We don't know anything very comprehensively about their behaviors at a national scale. We don't even know much about the outcomes of engaging in sexual activity outside of things that are often physiological in nature, like orgasm ability or not. We don't know very much about why people engage in sex in the ways that they do. I said, so we need to talk to people about that. We need to gather that information. And I said, this is the first exploratory step in what will be a much bigger project with longitudinal mixed methods and the establishment of a coordinated research network across the globe. And they were like, do it then. And so in December 2021, the Sexual Health Exploration Project was conceived. So in our first academic year, 2022 to 2023, myself and a core team, we came together to dream, plan, and assess our organizational structure, our internal and external factors, what we believed to be the uniqueness of our contribution, possible interventions we might get to eventually down the line, and the type of community support that we were going to need. I didn't do any work outside of the proposal on this project before that core team was established. So the first 6 months were actually just finding those people and hiring and onboarding them. They consisted of an undergraduate student fellow who worked as our director of public engagement, Deandra Escuela from UCLA. She was actually doing her baccalaureate in public affairs and needed an internship site all year for her capstone. And so we worked together in that way. A graduate pre-doctoral fellow, PhD candidate in counseling psychology, Natalie Malone, who's at the University of Kentucky. And a postdoctoral fellow, Andreas Cordero Jr., who lived in San Antonio, and among other things was a practicing sacred intimate, which is a sexual healing technique that's primarily used among gay men and was forged during the HIV/AIDS crisis in the 70s and 80s. So we've grown and contracted a lot since then. You'll see 17 current and 3 former core members. So we have a network of over 100 people, US, Canada, UK, Germany, and we're establishing some connections with community organizers in other places through these initial connections. But these are the people that I meet with regularly. We meet at least once a month. Some of us meet multiple times a month to just plan around our work. And we are united by a shared vision of a world without violence, even though a lot of what we do currently is about sexual health and well-being specifically. So some of that work looks like ongoing community engagement studios. So if you've never heard of that methodology, community engagement studio, it's kind of like a focus group, but it is different in the sense that all of our groups are facilitated by folks who are a part of those communities, so they share the identities or the lived experience of the groups that we're bringing together to talk with one another. We've run 21 of these with 90 people across the US. Our participants have been as young as 18 and as old as 73, and we've even reached people in Hawaii, Alaska, and Puerto Rico. And they've highlighted for us, as you can see sort of represented here, some of the structural and socio-political factors that shape their experiences as they navigate relationship building, intimacy, STI testing, reproductive care, and other aspects of sexual health and well-being. In the next 5 years, funded at least for now by the NIH, we will be analyzing existing texts, including handbooks of validated measures, non-English language advice books, and even historical and anthropological text, conducting more than 200 interviews, yes, 210 in the next year. We'll see. And we're going to launch a cross-sectional survey in pursuit of developing a strengths-based and asset-focused, comprehensive, and multi-dimensional scale of sexual well-being. So this scale will examine people's sexual identities, desires, behaviors, and outcomes, what some sociologists who reviewed the existing literature from surveys call the sexuality prism, featured here, as well as the core domains of sexual health and well-being, like security, respect, self-esteem, self-determination, resilience, those sorts of things, and look at how they operate within a range of psychosocial and structural factors: poverty, racism, sexual health rights legislation, incarceration, violence, fertility management, those sorts of things. Ultimately, we plan to use the results of the end of this project as the foundation for a number of currently planned violence intervention and trauma healing projects. One of which, again, we're open to the fluidity and the adaptability, but one of which is identified by our community steering committee is to build a community-developed, comprehensive sexual health re-education curriculum by and for trauma survivors. And this curriculum would center all of the things that we just previously talked about and focus on what someone who has experienced trauma would need or does need now that they've experienced violence. So what's different about your needs now and what you would want in your sort of sexual health education curriculum. That finalized curriculum and the modules we create from it will then be used in a train-the-trainer intervention, where we'll pull in folks who are already used to putting out curriculum, so university wellness counselors, family and relationship counselors, people who work at LGBTQ clinics, right? The folks who are already doing relationship skills classes sometimes in certain curriculum or violence prevention curriculum. And we'll train them in our curriculum to be able to then pilot it in their practices, private practices, universities, local communities, and then we'll retain them as trainers and eventually hold quarterly training sessions for anyone who'd be interested in the curriculum. One particular area that I would like to see is also families and caregivers of youth, particularly disabled youth. Other studies that I'm currently involved in that sort of function underneath this community-led, community-developed design involve ways to really, I think, more genuinely transform the health science knowledge ecosystem itself. So alongside a co-PI from the University of Pennsylvania School of Social Policy and Practice, we're actually working right now. We've got a Commonwealth Fund application under review, and then we're working on a PCORI grant. We're going to submit that LOI in January to actually think about how we might genuinely and meaningfully engage, proactively engage cognitively and neurodevelopmentally disabled folks in gender and sexual health research, which is really necessary because they experience higher rates of violence and are often left out of comprehensive sex, even when sex ed is comprehensive, they're left out of that curriculum. And their families, caregivers, other caregivers, home health aides, state health aides often lack access to adequate information to have any literacy in this area for them. So for this, we're focused really on accessibly doing research, not inclusively doing research. So again, accommodations are reactive, accessibility, like the caption here, is proactive. I didn't ask if anybody needed it. I just have it here. So that's what we'll be doing, but for sort of co-investigators in gender and sexual health research. We've also worked over the last 3 years to make sure that our expert skills, knowledge, and offerings don't stay within the ivory tower, but actually make it into community in these interim moments when we're collecting our data and waiting for bigger things to happen. It's a central part of our desire to build and sustain critical connections with folks who might otherwise see our presence as extractive only. As just a few examples of this, we ran a 4-part virtual roundtable series that featured voices from 19 people across the globe, representatives from the Translational Coalition, the Black Girls Guide to Surviving Menopause, the Center for Puerto Rican Studies, the Transgender Law Center, and even one of Emory's public health new faculty members, Candace Harkins, representing Global Majority Wellness. We launched an 8-week sex education series on our social media platform entitled What is Sex? That broke down the basics in jargon-free language as a hope to reach young people to increase their literacy around sort of safe sex competencies. We have an inaugural season of a podcast, which everybody wanted me to be the host of, so, you know, if you're into that kind of thing, it is available. We're hoping to add to it this year, but not with me as the host or the main person. And we're also translating all of our episodes and posting them on our new YouTube channel. So we'll be posting them as videos, and we'll be adding to that this year because based on some of the initial things that we're finding from our community engagement studios, the new co-directors of public engagement this year are actually coordinating student-led and run virtual town halls with representatives from universities across the U.S. So we even have folks coming from Brigham Young University, and they're planning 2 sessions. One is on staying safe in a time when some of the things that you might need for your health are becoming illegal or censored. So topics will include like safety on tracking apps when you're going state to state, or like period tracking apps, DIY HRT, so hormone replacement therapy, like these other things that are really important to young people, as well as navigating cultural and religious differences if you're living in a rural area, if your family's less than accepting, if you're an international or immigrant student, sort of navigating different cultural norms. And so again, these were determined not only from things that came out of our community engagement studios, but then also just things that the students themselves have said we need more of. Some of our members are also regularly hosting online workshops and webinars. Raheem Thoyer, who is a counselor, does a lot of work with queer and trans Muslim community and mental health. Josie Auger was just named as the director of Big Stone Health Commission in so-called Alberta, Canada. She does work with Indigenous women and femmes, Two-Spirit folks, and missing, murder, and Indigenous women communities, so the sort of broad reach of trauma within those communities. We have some folks who are engaged in visual storytelling practices. So Omashade Bernay Scott works with Black Girls Guide to Surviving Menopause to bring people together to share their stories, decreasing stigma and shame around menopause and end of life. And some folks just are direct service providers, providing opportunities. This is a little dark with a little light, but providing opportunities to grieve together, collectively grieve. So one of our partners is here in Atlanta and holds grieving circles very regularly for folks to show up to, or provide sexual surrogacy and intimate partner services. And I brought all of their ideas into my new role. I was named within the last 8 months as Associate Editor in LGBTQ Health for the American Journal of Public Health, and I'm using everything that the community tells me is important to bring in the types of manuscripts that I want to see in the journal, and so far they've been very supportive of that. So, inspired by our feminist foremothers and our trans and queer ancestors, within the next 2 years, it really is our plan to sort of solidify our embeddedness within our various communities and extend our reach. We believe that a handful of deeply connected people who share a vision can sometimes make more change than thousands of people marching on the Capitol. So to sustain our work, and again, if they still exist as institutions, one of the major grants that we're going to submit within the next year will be to establish a coordinated research network and get these folks paid. So again, for the past 2 years, I've been the only person paid on the project. So those 20 people that you saw on that screen just continue to orient around me and this work because we share a vision and we love each other. But I would like to get some of those people more significant funding and then get the projects they're working on also funded and to bring students into the work. I mean, we have big dreams, for T32s and K-level mentoring of early career faculty, cluster hiring, of postdoctoral groups. We have a lot of things that we're really interested in doing, and so we need the funding to do it. And then together, we'll have some other funding, we hope, to expand out the sort of research and education and advocacy arms of this trauma-informed work, and I'd love to talk to you more about it in the Q&A if you have questions for me. But for now, because you've given me 45 minutes and I want to leave time for conversation and I could talk all day, no one wants to hear that, I'll leave you with this slide. There's very literally no shortage of projects I'd be excited to develop, build, contribute to, sustain in my role. In true neurodivergent fashion, I see all aspects of health as being interconnected. And we're unable to sort of disentangle them from each other. And so these are some of the things I'm thinking a lot about now, but it's certainly not extensive. I will say that, as some of you probably know, a lot of these areas align with the community health assessment results, the reports that are put out, Kaiser, Piedmont, Grady, even Emory's own sort of CHA lists some of these areas. There are a lot of organizations locally that do work in these areas that I would, sort of love to become more deeply embedded with since I've only been here for a few months. But in some, I hope it's evident how I can see a sort of beautiful, generative, and long-term home for myself here among you at Emory. I would love for this to be the home base of a project that could really flourish, I hope. So thank you. I appreciate you listening to me blab on. I would be happy to talk now, to answer questions you have, or just to talk more generally about anything that you want to share with me.
Ethan, I'll maybe start off. First of all, thank you and congratulations on, really impressive, creative, and I think courageous in so many ways the work. So congratulations on all that, and thanks for sharing it with us. I want to ask you two things. One, I was really interested in you presented some focus on institutions, and I'm a big fan of work on institutions and their importance, the social institutions as kind of main structural forces in society. And so the first question is, and I think you've answered it in a number of different ways. There's quite an interesting representation of various types and levels of institution in your work. That's clear. The part that I always find the toughest is when you get into the establishment, power, hierarchical stuff. So the first thing is, if you could maybe say a few words about challenges in reaching into those kind of power structures. And then the second thing is maybe kind of related, and like a 30-second personal story. I had just a wonderful young woman working with me as a research associate, and transitioned while she worked with me for 5 years and is now an outstanding researcher at the University of Toronto. And Alex, that experience for all of us, very supportive community. We had all kinds of uncertainties. We didn't understand. And Alex was brilliant at kind of bringing us in and helping us. We've got a sort of personal journey with Alex Him now to, understanding that. But I wonder, where this whole fear and resistance and lack of understanding in society, maybe it's a bit related to the establishment side, but where do you see that fitting? Is there a way to sort of tackle that as part of this challenge of encouraging flourishing?
Yeah, so those are both good questions. The second question is, I think, just constantly on my mind. It is true that the way that moral panics work is to prey upon people's fears and their uncertainties, right? And so that's true for any moral panic, whether it was, it still is in lots of ways, right? But HIV, AIDS, or any other thing, trans folks in general. So built up on a bedrock of unclear information or outright lies, and we are in a moment where even if you give people the truth, sometimes they don't believe that that's true, right? Even if you can tell people here's a fact or a statistic and it's backed up by research or a study, people will still say, no, I don't buy it, I don't believe it, and I don't buy it. And so I do think a lot about what are the mechanisms with which we could reach people. And I think a part of that is, for me and for the collective, is just being on the ground in your community. Like, you have to have relationships with people. You have to talk to people like they're people. You can't talk to community like you're a researcher. You can't use the same language that you would use with the NIH. You can't. And so, I think in some ways because in some ways it's because I'm autistic, that I've never really, I'm code switching in the academy. I will tell you about my work the way you want to hear about my work. But that's not how I see my work. So I'm choosing language when I'm in these rooms that's actually very different than how I operate in my everyday life. And I think because of that, so I'm not switching something off to go into community, I'm actually switching something on to be here. I can see the ways in which we really have to be better about how we are having conversation with and in community, and the types of reasons we're giving people to believe us or to be with us in solidarity for some sort of program or intervention. So true education only happens when you can figure out the way to do it that folks will sit there and be in a dialogue. It's not hierarchical and it's not top down. It has to be reciprocal. That's that way. Now, the best way to do that, that's the question. That's the question ahead, I think, for all of us in the coming years is how do we reach those folks? And that's why, on this slide, one of the things I spend a lot of time thinking about, put this here because it's the only place I could think about it, but there are about to be huge groups of folks who, because of the things they were led to believe, voted for an administration that will absolutely be diminishing their rights and power even more. Poor folks will become poorer. Rural folks will feel even more disenfranchised than before. Those folks cannot continue to be left behind in the ways that we have already been leaving them behind, because that will only make it worse. All the fear, all the misinformation, all the belief in propaganda. So I think it's a task for all of us to be. How do we do that, and how do we just be real humans with each other? Yeah. In terms of the power structure question, there's a similarity there to the story I just told. So a part of working within powerful structures that often don't want to see you be successful, doing the exact thing that you want to do, it means code switching. It means figuring out ways to be slightly more subversive. So I have the things that I told the grant funder I was going to do, and I will do those things, but nothing's keeping me from asking some additional questions. Right? Nothing's keeping me from examining other things in addition to the things that I told them I would do. So I think part of it is not, I don't want to call it secret keeping, but it's the most sacred parts of your work sometimes are just for you and your collaborators, and you figure out how to navigate that and what really needs to happen. Some of it is learning to speak the language, right? So this is something, I was just on a call, American Journal of Public Health monitors call, and we've got a colleague who works in the Department of Health and Human Services. And she was telling us about how they are already preemptively changing the language on all of their internal documents and websites. So there will be no reference to climate change or climate crisis, but they will be seeking out solutions for climate innovation. So they're taking that entrepreneurial economic stance, right? The thing that sells it, or at least doesn't get attacked immediately by folks who are anti-climate science. And so that's another piece of it, right? Is like learning to speak the language of administrators, learning to speak the language of the elite in ways that, okay, if I use this word, you're gonna listen to me. You're actually gonna be receptive to the things I have to say. Again, how to change actual structures and systems. That's, for me, that's mass movement. That's all of us sharing a vision. That's all of us being aligned around what the goal is and figuring out the strategies and the tactics. I mean, that's like social movement organizing is what we're talking about, right? So doing it within your workplace or within your institution itself.
Yeah, and that's what it feels like. So congratulations and special thanks for invoking the hermeneutics of suspicion. I wish my health systems students were here. They would be like going, "Oh my God, we thought it was just Jim." Thank you.
Yeah. No, I just wanted to thank you for the authenticity of your presentation. I definitely experienced that. Your multilingualism and willingness to know the language of sort of positivist public health well enough to critique it really eloquently. And what I was hearing from the presentation was a lot of what I think students are interested in, but really are seeking skills, and that is social movement building and learning how to advocate for the issues about which they care passionately and deeply. And I think this is more of a comment just for reflection. I didn't really have a question, but I really wanted to say this. And one of the things we've started talking about in my own course on intersectionality and health is some of the biggest breakthroughs or shifts in public health have happened in the streets.
Yeah.
They've happened through strategic, measured, sometimes not so measured, coalition building, and understanding the impact of those kinds of strategies, both academically and in terms of the voice that is brought into public health institutions, I think is something that really resonates with students who are feeling disenfranchised and apathetic as a result. So there's so much, and disempowered, and I was hearing so much of a desire for engaging a research project that is fundamentally grounded in principles of empowerment, which is something about which I care really deeply from an academic point of view, but you're bringing in the lived realities of that, I think is a really important message for public health. So I just wanted to thank you for integrating science and really deeply authentic practice of the work. So it's just a comment.
Yeah, no, I mean, but you are right that, and I can't deny, and I don't think anyone should deny, that we would not be where we are right now with HIV/AIDS research if it weren't for ACTA.
For sure.
A non-scientific, community-based advocacy organization. Harm reduction.
But incredibly scientifically literate.
Well, yes, of
Yeah.
course, yes. But not like full. I mean, I'm sure there were some researchers who were in the mix or whatever, right, a part of the group, but it wasn't like it started in the health. And harm reduction is the same way. You know, teaching young people, like in Richmond, this has been really, really successful. Is that we have a harm reduction coalition, and now I would say that probably half of my students regularly carry it out. You know, so like teaching young people, like, hey, we have this opioid epidemic that's happening. We're hit really bad in this particular area. You may see people who have used, and you could save their life. Here, just carry Narcan with you has been, I'm sure, life-saving for folks out in the real world. And so, you know, I think that that's something we see happening to sort of grassroots, on the ground, food not bombs. Actually giving food to people is like this such revelatory thing that it's being like illegalized all the time. They're being raided just for giving out food to people. So
Yeah.
I agree.
Thank you for a great presentation and congratulations on really amazing and important work you're doing. I was curious to find out, how do you conceptualize, define, understand global health in the context of your work?
Yeah, no, that's a great question. So I think that there are a couple of ways that we think about it. I can talk about how I think about it, but I'd rather talk about what the sort of collective is thinking about. So partly, we understand that every issue that intercedes with and interacts on intimate partner violence, sexual health and well-being, trauma, etc. These are not things that are unique to people who are just in the U.S., right? So much of what we share is shared everywhere for these particular issues. And so we do have partners and we have made connections to folks in other places who are doing similar work. So Josie Auger is one of our partners and does work entirely in Indigenous community, First Nations community. And so we've been thinking about the ways that we can sort of more firmly collaborate not only with Indigenous folks here, but in Indigenous populations in other places. We work with folks in Germany who represent sex workers and former sex workers seeking asylum. And then I've got a colleague in Boston who works with queer and trans people who are seeking asylum. And so we're also thinking about how we can sort of strengthen those connections and collaborations as well, because most of those asylum seekers are fleeing violence, relationship violence, sexual violence scenarios. So, I think on the one hand, we understand some of these problems as universal. On the other hand, we also deeply understand that in other places, there are organizations who are doing a way better job at some of these problems than we're doing here. And so we often think, not we, so this is like a health science knowledge ecosystem we, maybe not like the we in this room, right? But a lot of we in the US thinks that the US is best. Like we do it best. We're the most innovative, we have the best techniques and interventions. Our collaborative has, found and centered that that's just simply not true. That there are grassroots organizations, advocacy organizations, researchers in other places who do a lot more with a lot less. And so we're also partnering with some of those folks to learn those tactics and strategies. Like how can we be trained and then train the folks in our collaborative to really recognize that you don't necessarily need to be at an Ivy League institution with a $40 billion endowment in order to effectively change public health equity in Europe.
So we're just about at time. Any last questions from anybody? Sophia?
I just had a quick question.
Sorry. Oh, and then go ahead.
No, go ahead. Okay. I was just curious, wonderful talk, thank you so much, about so you showed us and have given a lot of attribution to the folks you work with.
Yeah.
I was curious how you identified them and related to that, how you think about if there are groups that are not represented there and or how you grow it, things like that.
Yes. So I did an open call, like a national call for the pre-doc, the undergrad fellow, the pre-doc fellow, and the postdoc fellow. I had a team of folks current and former students, colleagues that I collaborate with on the hiring committee for those positions. And we interviewed a whole bunch of folks and then brought that team in. And then together, the four of us created this huge big list. Basically, we had competency areas, lived experience areas, and we just created like a huge list of people, names. Like we tried to strike a really good balance, and I think we did end up doing that, where we have 2 or 3 people who are other researchers, scholars, PhD educated folks. We have 3 or 4 people who actually represent nonprofit organizations or community advocacy organizations. We have 3 or 4 people who don't even have bachelor's degrees. One of them runs in Atlanta actually a BDSM dungeon. So just like people who have really broad expertise in area in sexual health and well-being. And we do have gaps in that. So, we've lost well, we didn't lose. Her organization got influx of funding. She became too busy, but we lost the only trans woman of color who was on our core team, and so we know we don't have that perspective anymore readily available. We need that perspective back. We also, we range in age between 20 or 21 and 57, but we really, really, really want to recruit at least one or two elders from the community. So we've got a growing list of people who are in their 70s and 80s that we want to sort of call in that way. So yeah, I mean, we sort of know where the gaps are. In full disclosure and all honesty, we should have probably been inviting folks to come meet with us and to see if they want to be a part of it in this year. But I've been traveling to Richmond to teach 2 classes, so infrastructurally, it just hasn't been supported to sort of do anything but sustain the research at the moment, and then work on some of the offerings like the webinars and sort of public education stuff that we do. But it's my hope that in the spring we'll start having those meetings and sort of drawing other perspectives in.
Thanks.
Ethan, are you good for a couple more questions?
Yeah.
Okay. Yeah, please.
I completely forgot my question.
Thank God that happens to young people.
Oh no. I'll ask it later when we meet. I'm so sorry.
No, it's not. It's fine.
Do you wanna try? Are you sure?
No, I'm okay.
We'll send memory vibes.
Thank you.
Yeah, I mean, this has been a very provocative conversation, and one of the things that our group is thinking about are places in the world where it's feasible, infeasible, safe, unsafe, to do some of the kinds of research that you're proposing. And I just wondered if you wanted to reflect on sort of the ethics of engaging individuals who might be very interested in conducting research that's anti-establishment, related to identities and violence, but it may place them at risk
Yes. Well, we actually
in their
had this
context.
conversation. We had a meeting last week as a collaborative to talk about whether or not we needed to edit our website and our socials, and whether or not people wanted their pictures and bios on the website
Right,
anymore, and to be identified in that way. And I mean, there's both the when talking about this is I just can't be anything other than anti-fascism. When talking about fascism, there is this notion do not comply in advance, right? That's the problem with it growing and solidifying itself, is that if you comply in advance, you're enabling the thing to take over.
Right.
And we are trying to balance that. I mean, a lot of people in the collaborative are no, we need this more than ever. We need to say this thing, we need to be doing this thing loudly more than ever. And there are some other folks, who are saying, I think the personal risk could be too high. And so we are trying to figure out how to balance that. And I think that in some ways, there's some work that's less risky to say that you're doing. So we know from NIH funding priorities that when we talk about sexual health, you're talking about STIs primarily. And that's where the major through line is. And so you can use the language of sexual health to mean lots of things, and it doesn't have to mean reproductive justice instead of just reproductive health, right? And so there are ways for us to exist publicly facing that maybe are not the same conversations that we have with folks in the room. But I have not even, it doesn't even feel particularly safe to be an out faculty member. And it hasn't for a while. I mean, I'm on multiple professor watch lists. So I just think that it hasn't been safe for a lot of folks for a long time. Being here, doing all kinds of work, and it will only get trickier as things potentially become illegal to do in the first place. And how we navigate that and continuing to provide resources, education, materials, skills, knowledge, access in community, I don't know. I'm genuinely terrified. And not because I want to be conspiratorial.
Yeah.
But because I'm scared that people will not want to engage in the conversation. In the same way, when we ran community conversations with Latin and Afro-Caribbean immigrants on the south side of Richmond, this came up. The folks who showed up told us that there were a lot more folks in the community who were interested in being there, but they were terrified about what we would do with that information. They didn't want to be reported, and or deported. So they were very unsure of, sort of like why we were coming. They knew the organization, we had contacts in it, we established a relationship, and still people were like, I don't want to show my face in that room, just don't. And so I think for a lot of groups, a lot of folks, it's been there.
I bring it up just to be very transparent because this is an issue that hits very close to home in our department because I think there are an increasing percentage of young people who want to do this kind of research, and they're not coming from the United States. So we need to think very carefully and thoughtfully about how to support and help early career professionals navigate their research agenda.
Yes. And I think there's so many prongs to that education though, right? There's the funding your research and sort of prong, like how you would engage in grant writing, specifically where you would find that funding and how you would get that funding. And then there's also this, of the many prongs, there's also the what are we teaching folks about law and the legal system? What are we teaching, about like what is and is not illegal and when it is or is not illegal and what we can and can't do. And then, how are we advising folks based on, and I would like to see, it's always my end goal, like the real transformation of this health science knowledge system is that we actually have more instructors in programs like this who are from community-based organizations. Because those folks have so much historical and institutional knowledge about how to navigate times when things are risky and illegal and still do the work. And so I just feel like we have a lot more learning.
All right, well, listen, I think we should give you a bit of a break. Ethan, thank you so much. Really, really appreciate it.